Us for the media briefing on this Wednesday. We're going to start with COVID-19, and if anyone out there has been watching hospitalization numbers, they certainly have a lot of concerns, and we're very pleased to be joined by representatives from some of our area hospitals today to talk a little bit about that issue. And let's start with Dr. Podell from Salinas Valley Memorial Healthcare System. Thanks very much, Dr. Podell, for joining us today. We've had you on last month, and you really gave us some great insight into the variants, and we're hoping you can talk a little bit about the variants and hospitalizations today.
Sure. First of all, thank you very much for letting me participate in this media conference. A month ago, we met, and what we talked about was there were a handful of Delta variant cases in our Monterey County. But as of today, our new cases of COVID-19 seem to be around 90% Delta variant. So it didn't really take very long for this Delta to take over most of the infections. What that means is this virus is highly infectious. It's really fit for transmission, especially in the unvaccinated population. So, as of last few months, we had very few patients in our hospital, and everything looked like it was near normal. The pandemic felt like it was ending, but recently we have seen increasing number of new diagnoses of COVID-19, increased hospitalization, some of which are very critically ill patients on ventilators, and we have had few patients die from COVID-19. So the trend is not what we want to see and what we're hoping right now. Most of the hospitalized patients who are extremely sick seem to be unvaccinated. So really this has become the pandemic of the unvaccinated population.
Thanks very much, Dr. Podell. We're also very pleased to have Dr. Martha Blum from Community Hospital joining us. What is happening over at Community Hospital? And I'm hoping you can also talk a little bit about the importance of vaccine if what Dr. Podell is saying is true, which is it's a pandemic of the unvaccinated. Can't we solve this? And I can't hear you. Dr. Blum, I can't. Going to give that a try? She may be regrouping. We're also pleased to have Dr. Craig Walls from Natividad on. Good afternoon.
Hi.
And I'm wondering if while Dr. Blum is regrouping, can you tell us what's happening at Natividad with COVID-19?
I can. So as Dr. Podell said, we were enjoying 0, maybe 1 patient for quite a few weeks. And we're up to 7 patients today with COVID-19, which is heading in the wrong direction, as Dr. Podell said. And I can tell you that the folks that we're seeing sick enough to be hospitalized who have received any vaccination, even 1 of 2, is vanishingly small. The vast majority are folks who have been unable to get the vaccine. A colleague was recently pointing out to me that, reminding me rather, that not vaccinated is not the same as anti-vaccination. There are folks for whom it has been a challenge to get the vaccine for one reason or another. They have trouble getting out. They don't have access. They don't have the communication, the understanding of where to go, et cetera. So I think we need to redouble our efforts to get vaccine into folks' arms. I think a lot of people who maybe were waiting are now ready. And what's really heartbreaking, and I know the other 2 doctors will echo me on this, is folks that are showing up to the hospital very sick, asking for the vaccine. And it's too late. We don't vaccinate folks who are acutely ill with COVID-19. So I would just urge the folks on this call to help us message the primary importance of vaccination, protecting not only yourself, but your loved ones.
Thank you very much, Dr. Walls. And let's see if we've got audio on Dr. Blum. Nope. We have got some audio problems with Dr. Blum. That is so unfortunate. You know,
Can you
do we
hear
have
me
a-
now?
We sure can.
Okay. All right. We'll give this a try then. Unfortunately, I have to echo exactly the same things that are happening at the other hospitals are also happening at community hospital. We had a very nice, quiet month of June. Unfortunately, very first week of July, we saw a sharp increase in hospitalizations of people with symptomatic COVID. Unfortunately, several of them required ICU level care. And so far, we've had 2 people pass away from COVID-related illness in the month of July. That's after 4 months with no COVID-related fatalities at our hospital. So we are also running a daily census of between 5 and 6 active COVID cases at the hospital. And so far, since vaccines have become widely available, 95% of our hospitalized COVID patients have been unvaccinated. So it is very much the same as we're seeing elsewhere. It's the unvaccinated are particularly susceptible to severe disease. And we expect that to continue until we can get more people vaccinated. And yes, even people who've had prior COVID infection, we do recommend that as soon as they're done with their isolation period, that they go and get vaccinated, because we really don't know how durable or strong the immunity is after having an infection. But we do know that after vaccination, so far, the immunity from the vaccine is quite effective. Again, upwards of 95% of people are protected against severe disease. And that immunity also appears to protect people from the more transmissible Delta variant. So right now, the strongest and most effective tool we have to protect ourselves and our community against COVID-19 is vaccination. So I really can't urge people strongly enough, if they haven't been fully vaccinated, to go out and start the process now. And for those who maybe have started the process but are awaiting that second shot, be sure to schedule that second shot and get it done.
Thank you very much, Dr. Blum. And then before we move on to our next topic, any last words from any of you on vaccine or Delta? Any last encouragements?
Yeah, sure. Let me just add something to Dr. Blum has said. I think, I 100% agree with her recommendation. And, right now we're seeing the wrong trend. And with this extremely infectious virus circulating around, and still a large number of unvaccinated population, we really want to make sure we protect the vulnerable people so that they don't end up in the hospital extremely ill. So since we have these extremely powerful tools of vaccines to protect yourself, please, I would encourage everybody to get that message out that these vaccines are highly effective, they're extremely safe, so go ahead and get your vaccine so that you can protect yourself. Otherwise, I think the Delta variant will find you.
Well, we don't want that. Thank you three very much for joining us today. If you're able to stay on the call for some questions, that would be terrific. We're going to move on to another topic, the alternate housing program. And really, that program was designed for people who were COVID positive or awaiting test results and needed a place to isolate. The program had gone down to nearly nothing. And it's really a snapshot of what's happening in the community, because now people are in need of the program. So we're very pleased to have Deb McElhaney and Lauren Suwan-Supa from the Department of Social Services to talk with us about what's going on with the program, what's available, and then also hopefully some safe isolation tips for people who may be experiencing COVID-19 now.
Thank you, Maya. Thank you for inviting us. So Deborah and I are from the Department of Social Services, but this really has been a county-wide effort in supporting alternate housing options for people who need a safe place to isolate. So the program is for those who are COVID positive or presumed positive. The program offers a safe place for them to isolate in a private area, and gives them access to some services that Deborah's going to share a little bit more about. We, as May had said, had been operating this program since really the beginning of the pandemic and had seen our numbers really dwindle down. But as your previous guest had mentioned, the surge that we're seeing that as well in our program, and numbers have been going up. So just really reminding people about the accessibility of this program for those who are homeless and don't have any other options of a place to isolate, those who may be in crowded housing in which safe isolation is just not feasible. This program is available to ensure that you're able to isolate and not spread COVID to your family, neighbors, and friends. I'm going to turn over to Deb to share a little bit about what the program offers as far as services go, as well as what safe isolation means for our program's purposes.
Thank you, Lauren. Good afternoon, everyone. And thank you, Maya, for providing us a platform to be able to talk about the services that we offer. I can absolutely relate to the doctors who shared previously about, we looked really good there for a while, and a lot of us were looking forward to these numbers staying low and going back to our regular jobs and our communities, kind of getting on with their lives, and all of us healing from this COVID pandemic. But unfortunately, our numbers are back up. I can just share with you our numbers within a 2-week period that we were at 1 at our main site, which is what we call Operation Oasis. And it is a park that has approximately 10 trailers right now that are up and active, and where people can stay to serve out their isolation. It sounds terrible, huh? Serve out their isolation, but be able to safely isolate through the COVID isolation period that the health department sets for them. It's a really nice environment, as you all know, and I'm probably speaking to the choir, is that this is a great place for people to be able to relax and heal. And as we were moving through the months, we were thinking, oh, the vaccinations are going to really be a game changer, and they really were for a while. But unfortunately, now our numbers within 2 weeks went from 1 to 22. We were serving folks at our main Operation Oasis site, and then also people who were doing some safe home isolation, which I'll get to in just a second. I would say 5 out of those 22 were vaccinated, and they still were able to contract COVID, but their symptoms were near nothing. The majority of them didn't even realize they were COVID positive until they were tested for some other strange reason like travel or starting a new job, something obscure like that. And then they're like, oh my goodness, really? I didn't even know. And, but we do currently, and this has been a story throughout, but just recently we have 2 people who were unvaccinated who were sent to the hospital right now, and they are struggling. They came to the park first, and we convinced them to go into the hospital, and thank goodness we did, because as the doctors told us, the symptoms are pretty severe for the unvaccinated. So we do have other people who are suffering significantly, but not at the level where they need hospitalization. So this variant, I would have to say, based on my year and 4 months of experience of serving those who are COVID positive, is pretty gnarly, to put it in layman's terms. It's a bit scary to watch it unfold right in front of us. So I think I'll just go ahead and move over to the safe home isolation practices and information that we share with the public. When we have someone who gives us a call, they're typically scared, or they're like, oh my gosh, I don't really want to leave. I have children, or, I don't really want to leave my house. I think I'm okay here. When we hear, we think we're okay here, or I think we can safely isolate, that really kicks us into the gear of like, okay, let's talk about what home isolation means. And we go through a series of questions with them, pretty much just a discussion. But what we help them realize is that their situation might not be safe, that there might be something that they need to think about, such as if they share a bedroom, even with a mask on, you can transmit COVID, sharing bathrooms, spending any length of time in there, going out of your room to cook yourself something to eat, and now you've shared the air with the rest of your housemates. And just even how tough it is to try to safely isolate as a parent when you have children, because they always want you. They don't understand that, mommy's in there for a really good reason. And they're always trying to get it. It's just very hard on a household and a family. So this is why we offer up this discussion, and then maybe help the family think about, okay, what's the next best thing that they can do. We can support them in their home isolation, and then we can also have them come into our alternate housing sites programs, where they are provided a great place to be able to isolate that has all the full amenities. They have their own place in one of the travel trailers or a motel room. And of course, then they have their own shower. We deliver 3 meals a day. They have initial medical assessments, and then ongoing daily check-ins from our RN who serves our program. And this has proved really a lifesaver, truly. I'm not just speaking figuratively here. Our staff and our regular alternate housing site program staff and our RN working hand in hand, and they know the symptoms. So what we can offer is the place where you can go relax, get better, have a support team behind you that is also looking at you from a medical perspective. So along with all that, and just feeling safe that I'll get through this, I'm okay. What we also offer up is a reconnection back to social services programs if you need that, transportation to any kind of appointments that you might have, access to equipment to continue telehealth appointments, or even newly established behavioral health appointments. We offer, if you have animals, you can bring your animal with you. Of course, there's rules around that, but we work with people, and we work with the SPCA, who also supports our efforts with people bringing in their pets, because many people will not come in unless they're able to bring in their pets. And laundry facilities, you name it, all they have to do is ask, and we try to figure it out for them if we can. I think that is it for me. Do you have any questions? Or Lauren, do you want to expand further?
I think we do questions at the end, but I will just make sure to make a clarification of with the home isolation, certainly to provide some support and advisement on how to do that safely. But our program is really only able to offer a more intensive support for home isolation if you actually qualify for our Housing to Harvest program, which is limited to people who work in the agricultural industry. Otherwise, services for the general population are for our housing.
Right, and we will reconnect people to the VITA program, the community health workers who will reconnect or connect with those families that are out in the community that we cannot serve. So there is a pretty good network to support our Monterey County communities through their COVID experiences. Also, too, I want to add one more thing, that we have access to 3 stipends that we can potentially provide to people who do the safe isolation and also come into alternate housing. So, and they're not anything to scoff at, because they're $1,000 a piece if the person qualifies.
So not to have anyone deterred over how to navigate all of those things, they can just to reach out to the program. We can help navigate what they may be qualified for.
All right. Thank you both. This is great information. I'm so sorry to hear that your numbers have gone up. And hopefully if you would stay on the line for questions after all of our presenters, that would be terrific. Now we're going to turn to Car Week, which is just around the corner. And Car Week, while loads of fun, makes it very challenging for local residents to navigate around the county when all these activities are happening. And we've got Frida Escobar from our Housing and Community Development program to tell us what's happening with Car Week, which is next week.
Hi, Maya. Hello, everyone. Thank you for having me and have given you the opportunity to showcase our wonderful map and tools. My name is Frida Escobar, and I am the permit coordinator with Community Housing and Development Department. And as Maya indicated, yes, Car Week is ramping up, and we have our permits in process. I'd like to take this opportunity to showcase the map that we have. It's interactive. Let me go ahead and if I could share my screen. Okay, can everyone see the map? Can you see it, Maya?
Yes.
Okay, so this here is our interactive map, and it tabs out actually the months, but obviously this is what we have going on in July. But as we start to move into August is when Car Week it will be happening. We have a special tab here specifically dedicated for Car Week. If you click on this particular tab, and I will add the link in the chat in a few minutes. This basically will give you the information on the events that I and my team are aware of. Let me bring it up here. And here it takes you through the events with regards to Car Week, gives you the dates, the names, and what have you. And as we start going through the actual weeks, or excuse me, the days of Car Week, we have a special week for that. August 1st, we have the Pasadena event happening, and then it goes into August the 8th, the 7th, the 8th, the 9th, and here the 10th is where it starts picking up, the 11th, and then there's a tab down. But I want to bring your attention to when you're viewing this map and you're deciphering which event you'd like to go to, you can click on to any one of these. For example, let's look at the Pebble Beach one. You can click on that. It'll give you the number which corresponds to the location on the map. If you scroll down here, it gives you some information, and then also will indicate if there is a permit that is required, if it's processed, if it's issued, or if it's an event within a city limit that is we wouldn't be permitting that particular event. That would be that appropriate city. But for this particular one, if you look at number 3, you would just click on the number 3, and then it would give you where, again, what the event is and the location. And you can go ahead and do that within the map, which is really, really pretty cool. Another feature that we incorporated this year, you'll see these little arrows throughout the county, and there are various areas, as you can see. This will give you some live traffic information. For example, if we go ahead and we click on this particular one, and then you click on info, here you will have live traffic. This is something that we partnered and we're streaming with Caltrans. So when folks are moving around the county and they're going from event to event, they'll be able to go on here and check live traffic. And again, this is through Caltrans. Might take a little while as far as the buffering goes. So yeah, that's it. Currently we have, let's see, we have about 10 applications currently in process that are going through. These are the larger events. We have been in close communications with CHP as well as the Sheriff's Office to ensure traffic plans are in place. Life, health, and safety is the #1 priority as we move through these. These events are getting larger and larger. So I really appreciate the coordination with the other agencies as well as the health department, making sure that the food vendors are permitted appropriately. And so we're really excited about this, and I just would like to give some kudos out to Dina Northcutt, my management analyst, who has partnered with Daryl Tyler from IT to make this happen. So we're hoping that folks utilize this and take advantage of this great technology tool that we put in place. Thanks.
Thank you, Frida. And I do know navigation around Car Week is really crucial. So bookmark that page so you know what's happening when you venture out for those days. So we'd like to go to our last participant for the briefing, last but not least. Very pleased to have Cindy Burnham from Hitchcock Road Animal Services. She's got some interesting information. There's always ebbs and flows with shelter intake, but Cindy, you say you've got some really high numbers, particularly with loose and aggressive dogs.
Yes, thank you, Maya. Hi, I'm Cindy Burnham with Hitchcock Road Animal Services, which is serving Salinas and Monterey County. And just for a brief intro, this is Dax. Dax is a 2-year-old min pin that came to us from South County, him and his brother Jax. So we have a match set. So he wanted to join me today, but we wanted to put out a reminder because we saw looking over our stats, some increases in numbers that were concerning to us. From April through June, we've seen a 50% increase in calls for loose, aggressive dogs in the unincorporated areas. So compared to January, February, and March, our calls are noticeably increased. So these are calls where somebody says, I'm walking down the street and this dog chased me, is acting aggressive, or it attacked my animals or my livestock. And so we've definitely noticed that increase. 34% increase in barking dog complaints from the unincorporated areas as well. And then for the shelter part, we've seen a 62% increase from animals coming in from both Salinas and Monterey County in those months. And so while we don't have, an exact cause, it does fall in line to summer vacations, people going back to work as things open up. And so we wanted to send a reminder to folks that while you're gone, or if you're now going back to work, it is still an owner's responsibility to make sure that they're keeping their folks like Dax here on their property, and especially if they've got some aggressive tendencies, because there can be some pretty serious repercussions. If your dog gets out and causes a car accident, kills or injured livestock, you can be held liable for that. Our pets have had us alone or home alone for quite a while with those that were working from home, and there's definitely a need to have a transition period if you start to go back to work, and our pets need that transition as well. We also just wanted to put some reminders. If you suspect your pet is lost, please come looking immediately. We have a texting program. You can text 831-LOST to 1-833-664-0513. And we've got that information on our website and social media. For barking dog owners, we just ask folks, if your neighbor comes and says, hey, while you're gone, your dog barks all day long, to listen to that, because a lot of times what we find is dog owners say, no, they're not barking, but you're not home when they're barking. So there's a lot of frustration with that. We understand that a lot of times we don't hear about it until you're at that level of it's driving you nuts. And so we just are asking for, pet owners alike to be patient. We do have some tools that we can use if it gets to us, but we always recommend that folks, when safe and when possible, to reach out to their neighbors and hopefully can resolve it that way. And those are kind of the reminders we wanted. We're not alone, I think, in some of these increases around shelters around California, from what I understand. But, it does come down to being a responsible pet owner and making sure folks like Dax here, are home, they've got ID on them, they're microchipped, the tools to use should they become lost. So that's what I wanted to share. Thank you.
Thank you, Cindy. And Dax seems pretty low key for being in front of the media and getting all this attention right now.
He is. He's great. He's very mellow. And even our notes on our evaluation said that he's just calm and collected. I have been feeding him little tiny pieces of cheese for my lunch, so that's helping too. But he's super nice and super calm. If you know that calm dog that everybody's looking for, come meet Dax.
And Dax is available for adoption?
He is.
And his brother also, his twin?
And his brother, his twin brother, Jackson Dax.
Thanks very much, Cindy.
No problem.
All right, that's all of our presenters. So we're gonna go ahead and start with questions, and we've got quite a few in. So let's get started. And some of these questions may have been answered in the chat, but we have folks watching on YouTube and Facebook, and I'm going to go ahead and give the answers. How many, I think this is for you, Dr. Podell, how many hospitalizations, COVID hospitalizations at Salinas Valley Memorial?
As of this morning, we have 7 hospitalized patients with COVID-19, and 3 of them are critically ill. And all of those have been either unvaccinated or not fully vaccinated.
Thank you. And then this question, I think is for all of the doctors. How sick are the vaccinated patients that you have in your facilities?
At Memorial, we don't have any fully vaccinated patients. So I think based on the science, vaccinated people, either when they're infected with, especially the Delta variant, they're either minimally symptomatic or asymptomatic for the most part, but you can get breakthrough infections. And the evidence shows that they don't become critically ill and they don't get on ventilators. So at Memorial, like I said, we don't have any fully vaccinated patients.
Thank you. Dr. Blum, is that the same with community?
Right now, we don't have any fully vaccinated COVID-19 symptomatic patients hospitalized. When we reviewed, we've had only 5% of our COVID-19 admissions, so people sick enough to require admission to the hospital, only 5% were fully vaccinated. So 95% of our symptomatic COVID-19 patients have been unvaccinated.
Thanks very much,
right.
Dr.
And none right now. All of the COVID patients are unvaccinated.
Thank you. And I'm not sure if I'm not seeing Dr. Walls. Are you still on the call? I'm not seeing him. And I'll try to get information from him later to follow up. We can move along with some of these other questions. This is for all the doctors. Are each of the area hospitals requiring all their employees to be vaccinated or at least constantly tested?
I can speak to that. On July 26th, the California Department of Public Health and our state public health officer issued an order that healthcare workers in California will need to either be fully vaccinated or tested once or even twice weekly if unvaccinated. That state order goes into effect on the 9th of August and we need to be in full compliance by the 23rd of August. So we are currently working to build a plan to be in compliance with the state health officer's order. Of course, we have been highly encouraging all of our healthcare workers to become fully vaccinated, and upwards of 80% of them are at this point. So right now, that's the situation, and we're going to continue to get as many, if not all, of our healthcare workforce fully vaccinated or in compliance with the surveillance testing.
We are doing exactly the same at Memorial Hospital too, and around 80%, a little bit over 80% of our healthcare worker has been fully vaccinated. And like Dr. Blum mentioned, we're encouraging all our healthcare force to be vaccinated. We're making it easily accessible so that anybody who has not received the vaccine can get it very easily.
Thank you both. And I think that also answers the next question, which was what percentage of workers in each of the hospitals are vaccinated, which you both said about 80%. I don't know if you want to add a little bit more. How are you urging the unvaccinated employees to get the shot?
Well, for us, we are continuing to provide education as to the safety and efficacy of this. We're doing one-on-one interventions with unvaccinated workers who may still have some lingering questions or may have some health concerns. So we're really treating it with education and by making the vaccinations easily available. As we all know now, there is an abundant supply of the vaccines in the county, and we also do allow some allowances to get the vaccine done, you know, if they would need some time off because of some vaccine related side effects afterwards, those kinds of things. That what we did from the very beginning as we vaccinated the vast majority of our workforce, making all kinds of allowances and helping people to get through the full vaccination process.
All right, thank you both. Our next question is over to the alternate housing program. Which park is Operation Oasis?
Hi, that's at the San Lorenzo Park in King City.
And, you know, I think additionally, maybe you could explain, you could share how the Operation Oasis is set up within the park, because the park is open.
Yes, the park is fully open. We have definitely reduced the size of our program, and we have 10 trailers now, and we are deep within the campground. And we're fenced off, completely separate from the park. So people can use the park for day use and enjoy it. And they have been all along. It's just now at a larger scale.
Thank you very much, Deb. Back to our doctors with some questions. Are you concerned that by recommendations for vaccinated people to wear masks indoors, that we're also removing incentives for unvaccinated people to get the shot?
Well, I think, you know, we're getting new evidence and data that even vaccinated personnel can get infected with Delta, although they may be asymptomatic, but the level of virus in their nasopharynx is extremely high, maybe 1,000 times higher than the original variant. So what that means is they may not get sick, but they are still at risk of transmitting the infection to the unvaccinated or vulnerable population around them. So the science is really dynamic and it's evolving. And as we get more and more data, I think the recommendations are changing. I mean, I can understand the frustration, but it is really driven by the data that's coming out.
All right, thank you. And another question for both of you. Are we expecting a surge, or in your opinion, are we expecting a surge in the near future, a COVID-19 surge?
Well, I think I'll go first, Dr. Yeah, I do think, that we are seeing a surge. There's no strict definition of that, but again, comparing to the COVID-19 hospitalizations in June, July is a stark contrast and a clear increase, both in numbers and in severity. So yes. Now, we have the same pattern in 2020 that we had the easing of restrictions in May, end of May, and then we had a sharp increase in June just a couple of weeks afterwards. So I think we're experiencing exactly the same consequences of the easing of restrictions in the face of not having complete immunity in the community. So yes, I think we'll continue to see more cases as long as we continue to have pockets of unvaccinated people. The good news is with a good portion of the population fully vaccinated, the absolute number of cases and the peak of COVID hospitalizations should be nowhere near what we experienced last summer, and certainly nowhere near the levels that we saw in December and January.
Yeah, I was going to say the exact same thing as Dr. Blum is we are already in the surge, and we expect to see increasing number of new patients and hospitalization, but probably not as bad as we saw in December, January, and February, for the reason that a large population has been protected with vaccination, and also probably the natural immunity is still there. When you add vaccine protection and natural immunity, we probably won't see as bad of a surge as we saw during the winter.
All right, thank you both. Continuing on with questions for the two of you, considering there seems to be very few breakthrough cases in Monterey County and 73% of residents here have gotten at least one shot, what percentage of the county's population should be vaccinated before the indoor mask recommendation for vaccinated people could be lifted, in your opinion or estimation?
I want to make one correction there. When we see the 73% with one dose of vaccine, that is not the percentage of the whole county population that's fully vaccinated. That is the percentage of the eligible population age 12 and up that has received at least a single dose. So we have 17% of our county population that's aged 0 to 11 and is currently ineligible for vaccination. So if you look at the percentage of 73% times 83%, that gives us 60% of the total Monterey County population that's gotten at least one dose. And again, one dose does not make a person fully vaccinated. So, when we start doing the math and really drilling down the numbers, we are probably maybe at about 50% of the Monterey County population that's fully vaccinated. So that certainly leaves us vulnerable, and we certainly have pockets and communities and neighborhoods where the percentage of vaccination of fully vaccinated individuals may be even lower than that. So it really is until we can get higher levels of immunity from vaccination or from natural immunity, we will be vulnerable as a whole county. And of course, we are a major tourist destination, so this doesn't even account for the people who may be entering our county as visitors from other areas and may themselves not be vaccinated. So right now, with this highly transmissible Delta variant, I think it is really wise for everyone to take stock of what their own health situation is, what the situation is of the members of their family, and take the proper precautions to protect themselves and those around them. And that should primarily be through vaccination, and then secondarily through other measures such as masking, physical distancing, and of course, as always, good hand hygiene.
All right, thank you. And then just a follow-up, you talked about people coming into the county, Dr. Blum. I have a question here. With the trend going in the wrong direction, as Dr. Bedell mentioned, are there concerns about the flood of people coming to the county for Car Week?
Again, we do know for sure that large gatherings increase the risk for potential transmission. Good news is outdoor events, the risk is much less. So I know many of the Car Week activities are outdoor activities, which should mitigate the risk. But again, anytime there are large group events, particularly if they're indoors, that increases the risk of transmission. And I know we had previously talked about there being super spreader events, but I just want everyone to sort of realize that with the new Delta variant accounting for 80 to 90% of all new infections, it is in itself a super spreader because it's so transmissible. So again, people will need to take appropriate precautions depending on their own health status, that of those around them and in their household, and what the circumstances are for whatever particular event it is that they're going to attend.
Dr. Bedell, would you agree?
100%. I think, although this event is happening outdoors, I'm sure after events could be indoors, like bars and restaurants are going to be crowded. So, we'll need to get that message as much as we can that, there's still plenty of Delta out in the community and that you protect yourself as much as you can.
All right, thank you. And then another question, slightly different topic for the doctors. Should we take our children to get tested if they have cold symptoms, if they are participating in summer camps or summer school or other summer programs?
That might not be a bad idea, especially if they are doing indoor camps. Because again, with predominant strain being Delta in our community, it's extremely transmissible. Children may not get very sick because they're resilient and they have good immunity, but it may be of value for contact tracing and making sure if anybody else whose immune system is not strong enough is being exposed, then they can monitor pretty closely.
Yeah, particularly any child who, of course, is unvaccinated. So those under 12 years of age, even mild symptoms could be indicative of COVID-19 infection. So yes, I would say, anyone with any symptoms that would be suggestive of COVID, including children, should be tested. And as a mother of 2 young school-age children, I can tell you that their summer camps, virtually all of them would require children who have symptoms like this to not come to camp until they had been evaluated and ruled out for COVID-19 infection.
All right, thank you, Dr. Blum. And our last question is for you, Dr. Blum. How sick were the 5% that were vaccinated at your hospital? Did they need oxygen or some other type of support?
3/4 of them required some COVID-specific treatment, and 1/4 of them, so that's of the 5%. So we're talking 4 people. So 1 did not require any treatment, and 3 of them did require treatment.
Thank you. And that is all the questions that I have. Wait, some are coming in. Another question for both of our doctors. Are all the hospitals reporting the similar incidents addressed earlier about critical ill patients asking for the vaccine? Dr. Walls mentioned patients came in ill and asked for the vaccine. At Salinas Valley and community, have you had the same experience?
At Memorial, yes, we have had a few patients, especially who have traveled from out of state, asking for vaccine when they're critically ill. But unfortunately, the outcomes were not very good. And by the time they end up in the hospital critically ill, it's too late. And unfortunately, that would have been completely preventable if they have had that thought of getting vaccinated early on.
Yeah, we're offering the vaccination prior to discharge if the patients remain hospitalized long enough that they complete their isolation period in the hospital. So yes, in a few cases, we have been able to even offer them the beginning of the vaccine series before they leave the hospital, because unfortunately some of them have required fairly long hospitalizations.
All right, thank you both. And that is all the questions that I have on the briefing. Thank you all very much for joining us to talk about this really wide variety of subjects. I see Cindy Burnham is still on the line, and I'm hoping she can give us one last look at our friend Dax, who is available for adoption at Hitchcock Road Animal Services. Is Dax gone?
He is gone. He got a little fidgety. But
all right.
He is up for adoption on our website, hitchcockroadanimals.org.
All right, thank you. And thanks everyone for joining us on the briefing today. Our next briefing will be next week, and we'll see you then.
Thank you, Maya.
Thank you.